Blood pooled in the abdominal cavity faster than the suction could clear it. On the monitor, a merciless flatline began to stretch out, and the alarms screamed through a room that was always kept cold and sterile. The legendary surgeon, the same man who, minutes earlier, had laughed off a warning, froze completely. The hands once praised as the golden hands of the hospital now trembled uselessly, suspended in midair. No one in the room dared to speak. Only one person stepped forward. She shoved his sterile gown aside, pushed him back from the table, and her voice rang out with a force no one had ever heard from her before. "Move!" She was a scrub nurse. No prestigious degree, no glamorous title. But in that life-or-death moment, it was her hands, not the genius surgeon's, that stood between a father of three and death. This is the story of Natalie Brooks, and the price of arrogance when it chooses to ignore the one voice in the room that actually understood what was happening. Oak Ridge Memorial Hospital was no stranger to pressure, but operating room 4 on that fateful Tuesday morning carried a different kind of atmosphere. The room was kept at its usual brisk 62 degrees, cold enough to suppress bacteria, cold enough to keep a surgical team sharp through hours of work. But the chill that settled over the surgical staff that morning had nothing to do with the thermostat. It came from a premonition that, at first, only one person in the room felt clearly. Natalie Brooks stood quietly by the sterile back table, her hands moving with practiced precision as she arranged her instruments in an order only she truly understood. It wasn't random. 12 years in the profession, 8 of them spent in the brutal trenches of emergency trauma surgery, had forged in Natalie a professional instinct no classroom could ever teach. She wasn't simply someone who handed over instruments on request. She was the one who orchestrated the rhythm of the entire table, always one step ahead, ready with whatever the surgeon needed before he even opened his mouth to ask. She knew the tensile strength of every suture by heart, the exact curve of every retractor, and, more importantly, she had an uncanny sense for when something was about to go horribly wrong. That wasn't magic. It was the result of thousands of hours of observation, thousands of surgeries where she had watched the unexpected unfold in the blink of an eye. The patient on the table that day was Samuel Jenkins, a 58-year-old local contractor, father of 3, known throughout the neighborhood for his booming laugh and warm heart. But hidden deep inside his body was a massive retroperitoneal tumor, resting precariously against his inferior vena cava, the great vein responsible for carrying deoxygenated blood from the lower body back to the heart. This was an extraordinarily high-stakes surgery, requiring the very best hands the hospital had to offer. The night before, Natalie had spent hours alone, carefully reviewing every page of Samuel Jenkins' chart. It was a habit she'd built early in her career, a near obsessive diligence that had, more than once, saved a life. And that night, as she scanned through the radiologist's notes, her eyes caught on a small detail, almost buried among dense medical terminology. The radiologist, Dr. Evans, had flagged a rare anatomical anomaly, a suspected retroaortic left renal vein, coupled with a fragile network of aberrant collateral vessels feeding directly into the tumor. In plain terms, the plumbing surrounding the mass was completely abnormal, fragile, and essentially a minefield. Natalie understood exactly what this meant. If the surgeon proceeded with a standard approach without first identifying and clamping these collateral vessels, the result could be catastrophic. Uncontrollable hemorrhage. She knew she needed to speak up. But she also knew the man who would be leading today's operation was not the type to easily accept a warning, especially not from a nurse. While arranging her instruments one final time before the preoperative huddle, Natalie glanced at the clock on the wall. About half an hour left. She took a deep breath, bracing herself for a conversation she knew would be anything but pleasant. She had worked with this surgeon before, and she knew exactly how he reacted when someone, especially a nurse, dared to point out a flaw in his judgment. But Natalie's conscience wouldn't allow her to stay silent. If anything happened to Samuel Jenkins that could have been prevented, she would never forgive herself. Even facing humiliation, even risking her own job, Natalie Brooks had made her decision. She would speak up. That is how a fateful day began. Not with a loud noise, but with the quiet resolve of a woman preparing to confront the enormous ego of one of the hospital's most powerful surgeons, simply because a stranger's life mattered more to her than her own reputation. Down the hall, Dr. Emily Carter, the lead anesthesiologist, was reviewing the same chart with a far more casual eye, unaware of the storm quietly gathering. Natalie alone carried the full weight of what she'd read the night before, and as she folded the printed chart under her arm and walked toward the pre-op area, she felt the same steady calm that had carried her through countless trauma codes. The calm of someone who trusted preparation more than luck, and who was about to find out just how far that trust would be tested. There was another reason Natalie felt the weight of this particular morning more than most. She remembered a case from 3 years earlier. A much younger patient, a routine gallbladder removal that had turned into a 6-hour ordeal because a similarly rare vascular anomaly had gone unnoticed until the moment of incision. That patient had survived, but only because the surgeon on duty that day had been willing to stop, listen, and change course the instant something looked wrong. Natalie had learned then that the difference between a close call and a tragedy often came down to nothing more than 30 seconds of humility. She wondered, quietly, whether Dr. Pierce possessed even that much. She also thought of Samuel Jenkins himself, not as a chart number, but as a man. She had spoken with him briefly the day before during his pre-admission visit, when he'd joked about missing his youngest daughter's soccer game because of the surgery, promising he'd make it up to her the following weekend. He had no idea how complicated his own anatomy truly was. He had simply trusted the system, trusted the hospital, and trusted that the people holding his life in their hands that morning would be paying full attention. Natalie intended to make sure that trust wasn't misplaced, whatever it cost her personally. If you asked most staff at Oak Ridge Memorial to describe Dr. Jonathan Pierce in one word, they would say brilliant. But given a second word, more than a few of them, especially the nurses, would whisper toxic. Dr. Pierce was the chief of general surgery, a position he had held for years thanks to a nearly flawless surgical record. He had trained at Johns Hopkins, one of the most prestigious names in American medicine, and he never let anyone forget it. The hospital's board of directors practically worshipped him, not only for his surgical skill, but for the prestige he brought and the revenue that followed. Wealthy patients, complex referrals from across the region, a steady stream of grateful donations from families who owed him their lives. But behind that golden reputation was a man who viewed anyone without doctor in front of their name as beneath him. To Pierce, nurses weren't colleagues. They were living, breathing furniture, meant to serve, not to think, and certainly not to speak up. He was infamous for his explosive temper, for berating staff in the middle of an operation, and for an absolute refusal to be questioned by anyone. Plenty of young nurses had cried in the locker room after a shift with Pierce. Some had even requested transfers just to avoid working under him. But hospital administration always looked the other way. After all, who wants to lose the golden goose over a few complaints about attitude? That morning, at exactly 7:15 a.m., Pierce strolled into the pre-op area with his usual swagger, a macchiato in hand, an air of casual superiority, and beside him, first-year resident Dr. Kevin O'Malley, an eager young doctor who was equally terrified of and devoted to his famously difficult mentor. Natalie was already waiting, chart in hand. She knew Pierce hated being interrupted, especially before a surgery, but her conscience wouldn't let her stay quiet. She took a deep breath and stepped forward. "Good morning, Dr. Pierce," Natalie began, her tone calm but firm. "Before we scrub in, I wanted to go over a few notes from the imaging. Dr. Evans flagged a potential anomaly near the posterior border of the mass." Pierce stopped in his tracks. He slowly lowered his coffee cup, staring at Natalie as if she had just addressed him in an alien language. A potential anomaly, Nurse Brooks. His voice dripped with theatrical mockery. Each word stretched out deliberately to emphasize just how absurd he found her presumption. That was only the beginning. But in that very moment, the line between two very different people, one driven by power and ego, the other by quiet devotion, began to sharpen. And no one in the room could have guessed that within hours, that same line would decide whether a man lived or died. Emily Carter, the lead anesthesiologist for the case, stood nearby, watching quietly. She had worked with Pierce for years, long enough to understand exactly who he was, and long enough to notice the rare flicker of worry on Natalie's face, a woman who was normally the picture of composure in any situation. The air in the pre-op area seemed to freeze. The younger circulating nurses nearby suddenly found reasons to look away, sensing the storm about to break. They all knew that once Pierce fixed someone with that particular look, things never ended well. But Natalie didn't back down. She had braced herself for this moment the night before, poring over every line of that chart. She knew she was walking into an uneven fight. On one side, the absolute authority of a chief surgeon. On the other, only the voice of a scrub nurse. But for Natalie, this was never about a clash of egos. This was about protecting the life of Samuel Jenkins, the man lying just a few feet away on his gurney, completely unaware of the storm quietly forming above his head. Kevin O'Malley, standing at Pierce's shoulder, shifted uncomfortably. He was still new enough to the hospital's culture that he hadn't yet decided whether loyalty to his attending or basic decency toward a fellow professional should win out. He said nothing, but his eyes flicked toward Natalie for just a moment. A flicker of something that looked almost like an apology, though he would never have dared voice it aloud. Pierce, for his part, seemed almost energized by the confrontation. Being challenged, however mildly, was rare enough in his world that it registered less as a warning and more as an opportunity to perform for his audience. He straightened his shoulders, set his coffee cup down on a nearby cart with theatrical precision, and prepared to deliver what he clearly believed would be a memorable lesson in hospital hierarchy. It was worth remembering, at this point, that Pierce hadn't always been quite this insufferable. Older nurses who'd worked with him a decade earlier occasionally mentioned, almost wistfully, a younger version of him who used to double-check his own sutures out of genuine anxiety rather than performative confidence. Somewhere between his early successes and his current title, that anxiety had curdled into something else entirely. A conviction that doubt itself was beneath him, that questioning his own judgment was for lesser surgeons. It was a transformation the hospital's leadership had quietly enabled for years, more interested in his outcomes on paper than in the atmosphere he left behind him in every room he entered. Yes, doctor. A retro-aortic left renal vein, along with several distended collateral arteries wrapping around the inferior margin of the tumor. Natalie continued, her voice steady despite her racing heart. Given how closely the mass adheres to the vena cava, if those collaterals aren't identified and clamped before the primary dissection, I know what the anatomy is. Pierce cut her off, his voice loud and dripping with condescension, deliberately pitched for the whole room to hear. He turned to the young resident with a smirk. Did you hear that, Kevin? We've got a new chief of radiology on staff. And to think, she only had to go to nursing school to earn that degree. A few of the junior circulating nurses looked away, cheeks burning in second-hand embarrassment for their colleague. The air in the room thickened. But Natalie kept her expression perfectly neutral, even as her jaw tightened beneath the surface. Dr. Pierce, the vessels aren't standard, she pressed on, voice even. I only bring it up because I've pulled extra vascular clips and set up a secondary crash cart with fibrillar and Surgicel, in case we need rapid hemostasis. Pierce stepped closer, invading her personal space. His eyes went cold. Listen to me very carefully, Brooks. I have performed over 400 retroperitoneal excisions. I trained at Johns Hopkins. You went to a community college. Your job is to stand there, keep your mouth shut, and hand me the DeBakey forceps when I ask for them. If you try to practice medicine in my OR again, I will have you written up and transferred to the outpatient podiatry clinic before you can blink. Are we clear? Natalie held his gaze for a long, agonizing second. She thought of Samuel Jenkins, lying on a gurney just a few feet away, trusting his life to this arrogant man. Crystal clear, Doctor. Natalie replied evenly, without a trace of a tremor. Good. Pierce tossed his empty coffee cup into a bin and turned toward the scrub sinks. Let's scrub. I want to be out of here by noon. I have a golf tee time. As Pierce strode toward the sinks, Dr. Emily Carter walked over to Natalie.
It's okay.
Emily was a veteran anesthesiologist, sharp-witted, who had seen her fair share of surgical egos over the years. She placed a gentle hand on Natalie's shoulder.
We're right here with you.
Don't let him get to you, Nat, Emily whispered. He's an ass, but at least he's a technically proficient one. Technique doesn't matter if you have tunnel vision, Emily, Natalie murmured, her eyes still fixed on the closed doors of OR4. He didn't even look at the MRI addendum. He's about to walk in there blind. I'll keep the blood bank on standby,
Stay focused.
Emily said quietly,
fully
fully understanding the weight of Natalie's concern. You just keep your setup ready. If he's wrong, we're going to need a miracle. I don't deal in miracles, Natalie said, turning back to her sterile field. I deal in preparation. That single sentence, simple as it sounded, was the guiding principle behind everything Natalie had done throughout her entire career. And it was the very thing that would save Samuel Jenkins' life just a few hours later. Where Pierce relied on reputation and unchecked confidence, Natalie relied on something far more solid. Meticulous, detailed preparation, never leaving a single possibility unaccounted for. By 8:45 a.m., Samuel Jenkins had been prepped, draped, and placed under deep general anesthesia. The rhythmic hiss of the ventilator and the steady beep of the heart monitor formed the familiar background hum of the room. True to his usual arrogant style, Pierce demanded that the circulating nurse play Vivaldi's Four Seasons over the surgical speakers, a way of asserting his own composure and command before an operation he was certain he would completely control. No one in the room knew that, within a matter of hours, that soothing classical music would be replaced by the most piercing alarm any of them had ever heard. As the anesthesia machine settled into its rhythm and the first drapes were laid across Samuel's abdomen, Natalie ran through her setup one final time, the way she always did in the last quiet minutes before the first incision. Extra clips, checked. Secondary crash cart positioned within arm's reach. Suction lines tested twice. It was a ritual she never skipped, no matter how routine a case seemed. Because she had learned long ago that the moment you assumed nothing could go wrong was exactly the moment something did. She glanced once more at Pierce, now scrubbed and gowned, joking easily with O'Malley about his golf handicap, as if the tense exchange in the hallway had never happened. For him, it seemed the matter was already closed. For Natalie, it had only just begun. She took her position across the table, drew a slow breath, and waited for the first cut. There was a particular kind of loneliness in moments like this. The loneliness of being the only person in a room who understood the full weight of what was about to unfold. Natalie had felt it before, in other rooms, with other surgeons, though rarely this acutely. She thought about paging the surgical director, about insisting on a second read of the MRI before proceeding. But she also knew how quickly that kind of move could backfire, how easily it could be spun as insubordination rather than diligence, especially against a man as politically protected as Pierce. So she did the only thing left within her power. She prepared for the worst while hoping, quietly, for the best. "Scalpel," Pierce demanded, extending his gloved hand. "Scalpel," Natalie echoed, slapping the instrument firmly into his palm. The first incision was flawless. Pierce's hands, for all his arrogance, were undeniably skilled as he moved through the layers of skin, fascia, and muscle. For the first hour, the surgery proceeded with textbook precision. Pierce spent the time quizzing the nervous resident, O'Malley, mocking him whenever he hesitated or answered too slowly. What's the borders of Kalit's triangle, Kevin? Come on, this is first-year stuff.
Now, if you'll excuse me.
Each correct answer earned a curt nod. Each hesitation earned a small, cutting remark delivered just loud enough for the rest of the room to hear. Natalie moved through the rhythm of the case with practiced ease, anticipating each instrument request a half-second before it came, keeping the field clear, keeping her own counsel. She had done this dance with dozens of surgeons over the years, and she knew how to read a room even when she wasn't the one speaking.
Watch that pressure.
What she noticed, though, was how little Pierce seemed to be reading the room himself.
Let's move quickly.
He was narrating for an audience, performing confidence rather than practicing caution. And that distinction mattered more than he seemed to realize. As the team retracted the bowel to expose the retroperitoneal space, the tumor came into view. A massive, angry gray mass, heavily vascularized, pulsing faintly with the patient's heartbeat. It sat deep, nestled tightly against the inferior vena cava, exactly as the scans had shown. "All right, Kevin, pay attention," Pierce said, his tone boastful. "The trick here is blunt dissection. We separate the mass from the surrounding fatty tissue before we ligate the primary blood supply. It's all about confidence." Natalie stood directly across from Pierce, her eyes darting between the surgical field and the monitors. She had already loaded several sizes of vascular clips into their appliers. Heavy right-angle clamps sat arranged in a perfect row, ready. Her instincts screamed at her. The tissue at the lower edge of the tumor didn't look like standard fat at all. It was engorged, dark, and spongy. Nothing like the pale, uniform fat she'd seen in 100 similar cases. "Dr. Pierce?" Natalie said softly,
Chief,
her voice barely carrying over the Vivaldi playing in the background.
Stabilize him now.
"The tissue at the 6 o'clock
Vitals are
margin
dropping
looks
and we need to
highly
stabilize him
vascularized.
immediately."
It calls for caution." Pierce didn't even look up.
No, that's incorrect.
"Nurse
I
Brooks,
said 10 blades.
I thought we had an understanding in the hallway. Hand me the Metzenbaum scissors." Natalie handed him the scissors. Pierce began snipping away at the connective tissue, moving too fast, entirely focused on proving his confidence to his student rather than reading the warning signs right in front of him. Each snip brought the tip of the scissors closer to the exact margin Natalie had flagged, and each time, she felt her pulse tick up another notch. For a moment, just one moment, Natalie considered whether she should say something louder, whether she should step outside her role entirely. But the unspoken rules of the operating room held her back. All she could do was warn him in words, and she already had, more than once. Now, all she could do was stand there, gripping her instrument tray, eyes locked on every inch the blade traveled. Emily Carter, from the head of the table, felt the same unease when she glanced at the monitor and saw Samuel's heart rate climbing slightly. She opened her mouth
Wait,
to
the
speak,
pressure's dropping.
but before she could, everything happened too fast. And then, in a single instant, everything changed. The scissors in Pierce's hand cut directly through the very spot Natalie had warned him about from the start, one of the fragile, aberrant collateral vessels Dr. Evans had flagged in the MRI. A small, almost inaudible pop sounded beneath the music, and then blood began pouring out. Not a trickle, but a strong, uncontrollable flow. In an instant, the room shifted from arrogant overconfidence into a silent, deadly panic. Later, when the surgical team tried to reconstruct the exact sequence of events for the official record, no one could agree on how many seconds had actually passed between the first drop of blood and the first shout for suction. Time, in moments like these, refuses to behave the way it does anywhere else. What everyone did agree on was this: it was the sound, more than the sight, that changed everything. The low, wet rush of blood filling the cavity faster than gauze or fingers could possibly manage. A sound none of them would forget for years afterward. Kevin O'Malley would later admit, in his private notes, that his first instinct in that instant was to look at Pierce rather than at the wound itself. A reflex built from months of training that told him the attending surgeon always had the answer. It took him a full 2 or 3 seconds, an eternity in a room like that, to realize the man he was looking to for guidance had none to give. "Suction! Suction now!"
I need more
Pierce
suction
shouted,
now.
his usual confidence gone for the first time all morning. But the blood was pouring out faster than the suction could keep up. Within seconds, Samuel Jenkins' abdominal cavity was flooded with deep red, obscuring the surgical field entirely. Emily Carter, from her position at the head of the table, immediately caught the shift in vital signs. "Pressure's dropping! 70/40 and still falling!" she called out, her voice remaining professional despite how quickly the situation was unraveling. Pierce tried pressing gauze against the bleeding site, but the tissue there was too fragile, exactly as Natalie had warned. Every time he pressed down, the bleeding only seemed to worsen, as if the entire network of abnormal vessels around the tumor was rupturing all at once. He called for a second suction line, then a third, his voice climbing in pitch with each request. The calm authority he'd carried into the room that morning dissolving with every passing second. Sweat began beading on Pierce's forehead, soaking through his surgical mask. The hands once celebrated as the hospital's golden hands now trembled, not from fatigue, but from a paralyzing fear he had never experienced in 400 surgeries. "He's losing blood too fast," O'Malley shouted, his hands shaking as he tried to keep the incision open. Natalie, standing directly across from him, felt the shift in the room's atmosphere with total clarity. She had witnessed plenty of hemorrhages during her 8 years in trauma, but something about this one felt different and more terrifying. The man leading the table, the one who should have been the steady anchor in this crisis, was the one losing his footing the fastest. She watched his hands shake, watched his eyes go blank, and somewhere deep inside her, real fear began to rise, not for herself, but for the man on the table, whose life now depended entirely on the people around him. On the monitor, Samuel Jenkins' heart rate turned erratic, the lines jumping wildly before starting to slow in an alarming way. The steady, familiar beeping became a rapid, piercing chain of alarms, like a death knell slowly tolling. Somewhere behind the drapes, a junior nurse whispered a prayer under her breath, too quiet for anyone but herself to hear. The circulating nurse stood frozen near the door, eyes wide, hands trembling, too young and inexperienced to know what to do next. She simply stood there, waiting for a clear command from anyone in the room. And then the worst happened. The line on the heart monitor stretched flat. The alarm shrieked through the room, drowning out even the Vivaldi still playing absurdly from the overhead speakers. In that moment, time seemed to freeze entirely. Jonathan Pierce, a man who had stood before hundreds of dangerous surgeries without flinching, now stood completely still, his blood-soaked hands trembling, his eyes fixed wide on the blood-filled cavity in front of him. He didn't shout orders. He didn't try to regain control. He simply stood there, utterly frozen, as if every ounce of his knowledge and experience had evaporated in an instant, replaced by the rawest, most primal fear of death itself. "Dr. Pierce!" Emily shouted, trying to pull him back to reality.
Come on, doctor, move!
"We need you right now!"
We need to act now. His
But
vitals
Pierce
are
didn't
dropping.
respond.
Why are you just standing there?
He took half a step back, as if pulling away could somehow separate him from the disaster unfolding right in front of his eyes, as if retreating could absolve him of responsibility for what was happening. And in that desperate moment, when the hospital's most celebrated chief surgeon stood completely paralyzed, when every eye in the room turned toward him waiting for an order that never came, something unexpected happened. The woman who had stood quietly by the instrument table all morning, the woman who had been humiliated, dismissed, and ordered to keep her mouth shut just hours earlier, now stepped forward, without a moment's hesitation. She did not look at Pierce, did not wait for anyone's permission, did not pause to consider what it might cost her license or her career. There was only the man on the table, the widening pool of blood,
The count now.
and a set of hands that
Maintaining
already knew
pressure here.
exactly what needed to happen next. It was the
Vitals
moment
are
this
dropping.
story would
I
forever
need
be
suction
remembered
and a
for.
fresh line.
In the seconds before she moved, Natalie's mind ran through everything at once. The cold weight of the clamps in her tray, the exact angle Miller would need for a graft call, the blood bank down the hall that Emily had promised to keep on standby. None of it was luck. Every piece of it had been quietly assembled the night before, while a tired chief surgeon slept soundly, confident that his 400 prior surgeries made this one no different. Natalie had never believed confidence alone was enough. Now, with a man's life draining out in front of her, that belief was about to be tested in the most literal way possible. Natalie Brooks didn't allow herself a single second of doubt. In her mind, everything unfolded with startling clarity, as if she had rehearsed this exact moment 100 times, even though she had never wanted it to actually happen. She stepped forward, shoved Pierce's sterile gown aside with her arm, and pushed him back from the table. "Move!" Her voice
Vitals are
rang out.
dropping.
Not the
I need
soft,
an
hesitant
airway
whisper
kit
she'd used
right
all morning,
now.
but a sharp, unyielding command that left no room for resistance. Pierce, still frozen, barely reacted as he was pushed aside. The entire surgical team, for one suspended moment, held their breath at a scene without precedent. A scrub nurse seizing control of the operating table from the chief surgeon himself. But Natalie had no time to think about what anyone else made of it. She plunged both hands into the blood-filled cavity, using touch alone to locate the source of the bleeding. A skill honed over years in emergency trauma. Within seconds, she found exactly the vessel she had warned about hours earlier. "Right ankle clamp, medium size," she called out, her voice carrying across the room. The circulating nurse, still stunned, reacted purely on professional instinct and placed the instrument in Natalie's hand. Natalie positioned the clamp with precision, stopping the raging flow of blood in an instant. "Emily, I need blood. Now. 2 units, as fast as possible," Natalie shouted, never taking her eyes off the field. "Already ready," Emily replied instantly, her hands quickly connecting the blood bags she had prepared in advance, thanks to the very precautions Natalie had insisted on back at the morning huddle. "O'Malley," Natalie continued, her voice unwavering.
Step away from the table.
"Call Dr. Harrison Miller right
Close this
now.
right now.
Tell him we need a vascular surgeon immediately. Ruptured vena cava from a collateral vessel injury." O'Malley, hands still shaking, bolted from the room to make the emergency call. Pierce stood
Patient
pressed
is
against the
hypotensive.
wall in the corner, his
We're losing
face
too much
drained of
blood.
color, eyes still
BP
fixed
is
on the
80
scene
over
in front of
50.
him. He said nothing. Perhaps, somewhere deep down, he understood that the very woman he had humiliated only hours before was now the only person capable of saving his patient. Every second that passed felt strangely slow to everyone else in the room, except Natalie. For her, everything unfolded with clear, ordered rhythm, as if she were performing a dance she had rehearsed 1,000 times. Left hand holding the clamp steady, right hand directing instruments, her voice issuing short, precise commands to every member of the team. Nothing wasted, not a single moment lost. The blood pressure readings on the monitor began to show signs of stabilizing, though still dangerously low. Emily called out updates constantly.
62.
75
Blood
over
pressure remains
45,
stable.
climbing
We are
slightly.
clear to continue.
Small numbers, but to everyone in that room, they felt like a miracle unfolding in real time. While waiting, Natalie held her clamp steady, directing the rest of the team to prepare additional hemostatic materials. The very crash cart with fibrillor and Surgicel she had quietly set up beforehand, despite Pierce having mocked her for it. 15 minutes later, Dr. Harrison Miller, one of the hospital's finest vascular surgeons, burst into the OR, having scrubbed in record time. He assessed the situation instantly and immediately recognized the severity of the injury. "Who put the temporary clamp here?" Miller asked, his voice carrying equal parts surprise and admiration at the astonishingly precise placement. "I did," Natalie answered simply, without a trace of pride. Miller looked at her for a moment, then gave a short nod, brief but full of professional respect. "Well done. Now I'll need a synthetic vein graft." Help me finish excising this tumor and get this man closed up. There was no time for further conversation, and none was needed. Miller began scrubbing at record pace, calling out his own preparations, while Natalie, without being asked, had already begun laying out the graft materials she'd anticipated he would need. It was a wordless understanding between two professionals who had never worked a case together before that morning, built entirely on the fact that both of them, unlike the man now standing silent against the wall, still had their full attention on the patient in front of them. The atmosphere in the operating room, moments earlier drowning in deadly panic, shifted into a quiet, focused intensity. No more Vivaldi, no more arrogance. Only the calm, deliberate sound of truly capable people working together to save a life. Somewhere in that shift, Kevin O'Malley found his footing too. He returned from making the call to Miller and, without being asked, began anticipating the next steps the way Natalie had all morning, passing sponges before they were requested, adjusting the overhead light without a word. It was as if the entire room had absorbed a lesson in real time. Competence had nothing to do with rank, and the person who had been mocked as just a nurse only hours earlier was the one holding the whole operation together. Pierce, still standing off to the side, watched in silence as the team moved around him with a fluid confidence he no longer felt part of. He had scrubbed out at some point without anyone quite noticing, peeling off his gloves with hands that hadn't fully stopped shaking. No one stopped him. No one needed him anymore, at least not for what remained of this surgery, and the realization sat on him like a physical weight he had never had to carry before. The next 4 hours passed in tense but controlled focus. Dr. Miller performed a complex synthetic vein graft, then carefully excised the massive retroperitoneal tumor, with Natalie assisting tirelessly at his side. By 2 p.m., Samuel Jenkins had been successfully closed, stabilized, and transferred to the surgical intensive care unit. When Natalie finally left the OR, pulling off her blood-soaked gown, the adrenaline crash hit her like a tidal wave. Hands that had stayed rock steady for 5 hours now shook violently. She leaned over the sink in the scrub room, splashing cold water on her face, trying to wash away the phantom heat of blood still clinging to her skin. The door swung open. Dr. Jonathan Pierce walked in, changed into a fresh set of scrubs. The color had returned to his face, and so, unfortunately, had his ego. The shock had worn off, replaced by the calculating instinct of a man trying to rewrite history to protect his own reputation. "Well," Pierce said, leaning against the door frame with a false air of casual authority, "that got a little messy, didn't it? But we pulled it out in the end." Natalie slowly reached for a paper towel, drying her face. She didn't look at him. "There is no we, Dr. Pierce."
I will not stand by and let you
"Careful,
endanger this patient.
Brooks," Pierce warned, his voice shifting into a threat.
"Shoving
"Shoving an attending surgeon is grounds for immediate termination and loss of your license. I'm willing to overlook it, provided the operative report reflects the correct sequence of events. An unforeseeable anatomical anomaly, textbook attempts on my part to control the bleeding, and a directive from me for you to apply the clamp while I called Miller for the graft. A collaborative effort." "You froze," Natalie replied, her voice cold and sharp. "You cut exactly the vessel I warned you about. You panicked, and you stood against that wall while that man bled out."
Stay in your lane.
Pierce sneered, stepping closer, trying to intimidate her physically. "Who do you think the medical board will believe? A chief surgeon with a flawless record, or an insubordinate nurse with a hero complex?" "They'll believe the whole room,"
Potassium levels are
a new
critical.
voice cut
We
in.
need to
The
stabilize
door
him
opened
before we
wider.
cut.
Dr. Emily Carter walked in, followed by Dr. Kevin O'Malley and Dr. Harrison Miller. "I've already filed my anesthesia
Your
incident
anger
report,
is
Jonathan,"
noted, Chief,
Emily said,
but I will
noting the
not
exact
clear
time of the rupture,
patient
the
until
precise
his
blood
vitals
loss, and the
stabilize.
undeniable fact that he had
We
abandoned
wait.
the surgical field. "Kevin has submitted his resident log, corroborating my report." Pierce whipped around, glaring at the young resident. O'Malley, if you file that, your career is over before it starts.
But I truly believe this is the
My
best
career
course of
means
action for the
nothing
patient.
if I lie about a patient nearly dying because of
I know I should have
arrogance,
spoken up sooner,
O'Malley answered,
but I
his
truly believe
voice
this is the
still
best
shaking
course of action
slightly.
for the patient.
Nurse Brooks saved him.
We both know
You
this isn't the patient we
froze.
prepped for. You can't just open him up
Miller
anyway.
stepped forward.
This is highly.
I've
This
also
operation
submitted my
requires
surgical
precision.
addendum
There is
along
no
with
margin for
Dr.
error
Evans'
once we are
MRI
inside.
notes.
Let's-
The anomaly
This
was
specific
clearly
sagittal beam
documented.
highlights the compromised
You
area.
ignored it.
Note
You
we
are a
maintain
danger
standards
to
for a
this
reason.
hospital.
What you did out there was a
Pierce's
violation of your
jaw
oath and-
clenched tight. Realizing he was completely cornered, he said nothing more, pushed past them and stormed out, the door swinging shut behind him. 2 days later, the hospital's
confirms our
medical
initial
executive
assessment.
committee
The
convened
tumors
an
are
emergency
aggressive.
morbidity and
Then we
mortality
proceed with
conference.
the trial protocol
The
immediately.
evidence was overwhelming. Between the MRI timestamps, the anesthesia records, and the unified testimony of Dr. Carter, Dr. O'Malley, and Dr. Miller, Jonathan Pierce's entire defense collapsed. He was immediately suspended pending a full board investigation, stripped of his title as chief of surgery, and eventually forced into an early, disgraced resignation. For Natalie, the news brought no sense of triumph. She simply felt relieved that justice had been served, and more importantly, that Samuel Jenkins had survived. A week after the surgery, Natalie walked down the quiet hallway of the surgical recovery ward and stopped outside room 412. Samuel Jenkins sat up in bed, tired but undeniably alive. His color returned. Beside him, his wife held his hand tightly while their 3 children sat on the small sofa by the window. When Samuel saw Natalie in her familiar blue scrubs, a wide, weary smile spread across his face. Dr. Miller had visited him the day before and explained in full detail everything that had happened in that operating room, sparing no detail about the surgeon's failure and making it abundantly clear whose hands had truly saved his life. "Nurse Brooks," Samuel said, his voice raspy but warm, reaching his free hand toward her. Natalie walked over and took it, warm, strong, pulsing with life. "I hear I owe you a little more than just a thank you," Samuel whispered, his eyes shining with unshed tears. "You don't owe me anything," Natalie said with a smile, squeezing his hand gently. "I was just doing my job." Walking out of the hospital that evening, Natalie Brooks felt a deep, quiet peace settle over her. She didn't need glory or a title. She knew her worth. She was the true backbone of the operating room, a woman whose hands had once held the line between life and death. She thought briefly of all the young nurses she'd trained over the years, the ones who still hesitated to speak up in rooms dominated by loud, confident voices. She hoped that somehow word of that morning would reach them, not as gossip, but as permission. Permission to trust their training. Permission to trust what their eyes and instincts told them, even when the person across the table outranked them by every title in the book. Some truths, she knew, were only ever proven the hard way. She was simply grateful this one hadn't cost Samuel Jenkins his life. If Natalie's quick thinking, extraordinary courage, and unshakable refusal to back down in the face of arrogance kept you on the edge of your seat, hit that like button right now. Stories like this remind us that the real heroes in medicine don't always carry the fanciest titles. Sometimes it's the calm, overlooked voice in the room that makes all the difference. Share this video with your friends to celebrate the hard-working, dedicated nurses who quietly save lives every single day. And don't forget to subscribe for more powerful, real-life medical dramas. Let us know in the comments, if you had been in that operating room, what would you have done? And what moment in this story stood out to you the most? Thanks for watching. See you in the next story.